Good morning, students.
Good morning, sir.
Good morning,
Yes,
sir.
yes,
Good
Morning,
morning,
sir.
sir.
yes.
Good morning, sir.
Good morning.
Good morning, sir.
Yes. Society versus nursing. The study of society, how much important for us? We have know that the components of societies, including family, religion, education, etc. What is mean by nursing? Five functions are we had been learned: care, cure, prevention, promotion, rehabilitation. Then each parts of society how to support to nursing. The nursing only for society. If change society, the nursing will be changed. For example, care plan, prevention strategies will be changed. Today we are going to start with religious system and nursing. Is religious data need for nursing? In clinical setting, nurses assess the client religion and their belief towards supernatural and religious philosophies. Also, nurses should be measure attitude towards religion. The religious data information help to nurse for nursing diagnosis, which help us religious oriented care as well as treatment plans. Next, educational system and nursing. Different types of education in our society. The educational data is essential for nursing in clinical setting first. For client oriented care, educated people need different care plan than illiterate. For example, well educated people need standard words or English knowledge used to educate the client or connect with the patients. But illiterate need different kind of care as well as support. Next, in community setting concern, nurse collect the data which type of educational facilities facilities are available in particular community. For example, when you go to urban setting, they measure the area, community area, and how many schools are there, how many colleges are there, and government colleges. These all the data, up to date data should be kept by the community health nurses. When you appointed as a nurse in the community setting, the government sector, these all the data are readily available. Nurse frequently visit that area, the educational setting. For example, implement various government programs. For example, school health programs. School health programs. Next, community system and nursing. Community is a specialty in nursing, community health nursing. Next, in clinical setting concern, nurse should be assess client community. Urban patients need different care than rural. The reason is that urban people more educated are different setting than rural people. Then social groups and nursing. Study of social group very useful for nurses. First, to develop healthcare team, which is nursing management concern. Next, in caregiving area, nurses need to know about the group choosiness of the client. For example, the patient participate with any bad groups, for example, alcoholic groups. Or which type of group which is very important for better care plan as well as treatment. The detail about group we will be learned in 4th unit. Then economic system and nursing. The economic system determine occupation of the client. Which type of job doing? The job area may be causing the diseases, occupational hazards. So this data is very essential for nurses for care plan and support to treatment plan. Then political system and nursing. students, the nursing professional activities have been controlled by government, by legislations. For example, INC Act, Indian Nursing Council Act. Then professional activities, mainly registered nurses, should be registered on council by the nurses after completing the course. Then the government determine or choose to implement government programs. For example, immunization government programs are implemented by the nurses only, So, nurses need enough knowledge regarding political system, mainly law. Indian Nursing Council Act 1947. And ecosystem and nursing. In modern society, sustainable development goals aim to environmental oriented care. The nursing care should be environmental friendly and should be educate the client how to protect the environment, how to improve the health, mainly environmental health. In community setting, nurses assess every family environment, for example, surrounded by physical environment, social environment, as well as biological environment. The separate the format available in community health, we will be measure defined way. For example, how many animals are in the families, as well as how many members in the families, and assess case study, family case study. So these nurses should be measured physical, biological, and socio-psychological environment. Then social problems and nursing. The nurses actively participate eradication of social problems. Then social welfare and nursing. Every types of welfare organized and done by the nurses, mainly child welfare, women welfare, welfare for disabled, etc. The detail we will be learned in 12th unit. Next section, nature of sociology. What do you think about nature? Nature means is what is available or naturally how we need to study the society. Whether this sociology is science or social science. two opposite view about nature. Science, second arts or social science. Science, we know that, for example, biology, physics, chemistry, like this. Social science means study of relationships. Which means the science having more fact than social science. First, we are going to detail about sociology is a science. Sociology make use of scientific methods What is meant by science? Already we have discussed in examples. Body of fact or truth. Operation of general laws. Define science. Systematic body of knowledge based on reason and evidence. Characteristics of science. Objectivity, verificability or verifiability, ethical neutrality, systematic exploration, reliability, precision, accuracy, abstractness, predictability, then generalization. Next, scientific characteristics of sociology. It studies social phenomenon. Every social phenomena are factual. It has scientific evidence, reason and evidence. For example, cooperation, conflict, marriage. It has generalized, which means a particular social phenomenon is same for everywhere. For example, conflict is a phenomenon due to various reasons, which is we can see everywhere. Conflict, cooperation is part of society. Second, sociology is a factual. Fact means which is cannot change. I would like to give one scientific fact. In science, for example, in sun rays east, it is change anytime, cannot change. This which is science. In the same way, social phenomena are having the same kind of acts. So using scientific methods such as observation, third one, sociology frames laws and attempt to predict. The scientific only we can make better laws. The reason, for example, mathematical law. But in social, mainly the sociology is difficult to make, but we can predict. Sociology frame laws and attempt to predict, since can make prediction on the basis of universal values. Illustration, for example, poverty. Can you predict poverty? Yes, we can predict when a society become poor, mainly by means of illiteracy plus unemployment. There is no job, there is no education. We can predict the people can suffer from poverty. So which means prediction. Fourth one, principle of sociology is universal. Universal means everywhere. For example, principles of families, American families, Indian families, or European families, not same as universal phenomenon. Fifth one, it discovers the cause and effect relationship. For example, scientific cause, the same as causes of poverty, we know that. And effect is that, in other words, the effect of illiteracy and poverty, illiteracy and unemployment is poverty. Sixth one, sociological principle is veridical. Veridical means verifiable. We can repeatedly verify. Can examine their validity. Next, we are going to detail about sociology not a science. It is a social science. Social science means study of human society and individual relationship. The social sciences including sociology, psychology, anthropology, economics, political science. So these are the disciplines study about relationship only. For example, political science study political relationship. Then detail about non-scientific characteristics of sociology. First character, lack of experimentation. Students, the scientific phenomenon we can test in laboratory. For example, chemistry, physics. These all we can test in experiment laboratory. But sociological phenomenon cannot experiment in that setting. So study of sociology is not a science, it is a social science. Second, lack of objectivity. Objective means setting standards or setting aim, which is impossible or difficult. Due to various reasons, this always changing. For example, family relationship is able to set or in the educational setting or political system, able to set objectives permanently is impossible. So objectives may be changed. Hence, the study of sociology is not a science, it is a social science. Three, lack of exactness. Exact means correct measures is impossible. So the study of sociology is not a science, it is a social science. Fourth one, inability to measure subject matter, which is important one. For example, in physics, we can measure the weight, kilogram, measure the water, liters, the liquid, measure the gravity. The same in chemistry as well as. We have some measurement. But how to measure the relationship? Is able to measure by any measurements is impossible. We can measure qualitatively, not quantitatively. Qualitatively means good, better, best, like this. The quantity means kilogram, like this. This which is accurate one. So that the study of sociology is not a science, it is a social science. Then lack of perfect exactness we will learn next class. Thank you for us.
Thank you, sir.
Okay, students, thank you.
Sir.
Thank you.
Thank you, sir.
Thank you, sir.
Thank you,
Okay.
sir.